Hello everybody, MCFRS. Today's Friday, April 24th, and we're coming to you from the front of Station 35. As wanted to give you an update, touch base on a few things, and talk to you about the coronavirus. It has been 7 weeks. We have been involved in this campaign for 7 weeks. It was the very beginning of March the 4th, that we sent you the first communication about coronavirus. This has been a long campaign. It will be a long campaign. The tempo is going to stay at this level, I suspect, for probably another 2 months before we start to see a change or a downturn. Yes, I understand this is taxing on each and every one of you, and I appreciate the endurance that you're showing. I appreciate your steadfast commitment to helping each other and helping the folks in Montgomery County and our neighbors. This is a once-in-a-lifetime event. It's surprising when you go back and say it's been over 7 weeks since we started this. On a daily basis, we're running about 10 to 15% less calls compared to the last 2-year average for each day of the week. But we're running sicker people. We're running patients that are in a more demanding, a sicker state. So our priority 3 calls are down, but our priority 1s and 2s are up. We're seeing that. You're seeing that as you treat these folks. This could be because of a couple different things. People who are afraid to go to the hospital. People who are deferring treatment that don't want to go to their primary care. So we need to make sure that everyone is getting that high level of care, and I understand you're going to be facing these sick people that require a lot of interventions and a lot of skills. Let's talk about those PUIs. We're seeing on average about 60 PUI classified, or patients that classify as a PUI, on a daily basis, and absolutely that's taxing to each of you as you have to wear extra protective equipment, do additional steps of communications, coordination, and decon. I don't expect that to see a change. As you see on some of these charts here, we're seeing a peak in calls, and certain call volumes are changing. One of which that we hear and we think is getting to become more and more prevalent is cardiac arrests. This chart shows you that our cardiac arrest volume is staying within normal limits. Some days we're a couple over. The daily average is a little over 8 cardiac arrests, and that's what that green line is. You see it's a little bit above, a little bit below. But we do indeed perceive that we're running more cardiac arrests. We're absolutely, as Captain Tim Burns outlined, running sicker patients. When will the surge be over? When will the peak be upon us? You heard me once before say April 17th was going to be the peak. That's what one of the models said. I wrote that peak was a little bit of just science, a little bit of just blind luck and gambling. There's newer modeling that says at the current rate we may be through the end of May before we see the peak of our hospitalization, before we see the peak of the impact based upon current social distancing rules. This is being taped at 2 o'clock on that Friday afternoon on the 24th. Governor Hogan's going to announce some information later today, which will probably be the roadmap for Maryland to work towards reopening. And we all collectively have to work together to keep our focus, support that 14-day downward trend of new cases, to do different things towards reopening. All of this is tied together. And part of that reopening will be masks and coverings. Was it the Incredible Hulk mask that I had when I started off? Was it the jersey cloth or the t-shirt cloth face mask? Is it something that you made? This week, we implemented face coverings. And we're using that word very uniquely, face coverings, because it can be a bandana. It can be a t-shirt material. A mask is something that is commercially available, N95 respirator or a surgical mask. But face coverings are critically important. It's required by the state, by the county, when you're in certain commercial establishments, transportation, department policy. We implemented it this week. If you cannot be socially distanced from your shift mates, if you're not in a private area, you need to have your face covering on. It is the best way to keep you healthy, to keep you from getting the virus that someone else may unknowingly have, or to expose others. So face coverings and procedural mask. It was actually a big move for the organization to say that we were going to wear these on every EMS call. That was a critical decision, and you're going to see that probably lasting for many, many weeks and months. One of the things that I want to talk about when it comes to face coverings, face masks, is we know for a fact that it's impossible to wear this while eating, while drinking. Sleeping is another one. There's different controls that you can do, keeping you at least 6 feet apart from you at the kitchen table while you're eating. Making sure that you're not head to head with a person in a shared sleeping space. Even bunk beds. Instead of having both heads on one end, one head to the left side of the bunk and one head to the right side of the bunk, and you've achieved in excess of 6 foot separation between the two people using the bunk bed. Use appropriate direction and a diligent thought as to how you help each other and how you go about wearing the face coverings and activities of social distancing intra-station. Let's talk about covers, face mask. Every call. We've had a couple incidences that talking to the folks who luckily are doing well, but who may have been exposed, they went on a car crash. They were focused on the extrication, the 3 folks that were trapped in the car. Didn't wear a face mask while operating the tools on the outside as a person from the engine company. On a different call, somebody may have been wearing a surgical mask. The surgical mask broke, and they were unable to get to another surgical mask in short order, and potentially was exposed to one of our patients. Think about that. Always realize that every patient encounter, you're supposed to have a surgical mask on. High-risk patient encounters, you have the N95 on and the gown and the gloves. And what do we say about every patient encounter? Goggles. These only help your airway. Goggles are the necessary component for the other mucous membrane up there, your eyes. Safety glasses, clear anti-safety glasses, don't give you enough complete coverage, full contact coverage, which is why the goggles or the face shield is in place. So remember that. Let's talk about the components of automatic fire alarms. Going to the grocery store, an odor of smoke, absolutely. Wear your surgical mask on that call, wear your face covering on that call, all times. Use that as a benefit, as a tool to help you. Now, we've implemented this week some questions, some screenings, and I want to talk about temperature checking or the temperature screening component. About 30% of folks in one study that became COVID positive did not present with a febrile condition as one of their symptoms before being determined to be positive. So the original 3 key factors of COVID was fever, shortness of breath, and cough. That's expanded extensively, and I want to read exactly what's on our list as those components. Fever with or without chills, a dry cough, uncontrolled secretions from the nose, excessive sneezing. The one that's come up, loss of taste or smell. That's a new one that came in as a COVID related. GI issues, diarrhea with acute illness, shortness of breath, or a prolonged sore throat. So those questions are what each officer is asking you twice a day, 0700, 1900, and asking you, and I'm going to read it verbatim. I'm about to read you a list of symptoms commonly associated with COVID-19. If you have any of these or feel ill in any way, please see me immediately and privately. Your honesty in this process is necessary to reduce the risk of others getting sick. Now let's talk about that to each of you. Hopefully, you call out sick before coming to work and tell the captain that you indeed have one of these symptoms. You need to take that extra step. Just like we put on the blog 2 days ago, this graphic, the fact is, don't come to work sick. Don't come to your standby sick. If you have one of these symptoms, you don't feel 100% right, take the extra step, be 100% safe, and separate yourself from your crewmates, from your shift mates, for your health, for their health, and for the rest of the county. It's very important that you recognize that this is not one that you tough it through. This is not one that you say, oh, I'm going to go to work, I feel bad, I'm going to, power through this, and I'll be okay, I'll get past that. That could be the first sign of this illness coming on. Yes, we're in the allergy time frame, it's spring. You may be normally pollen and tree pollen and grass pollen allergic person. It's a bad time of year to be talking about some of these symptoms related to pollen versus related to COVID. But yourself, you're the best person to control that. Co-workers, you have a question about one of your folks, talk to your supervisor. Because if you hear them coughing, if you see them having that perpetual running nose and they're rubbing their nose and tissuing, talk to the officer. What's going to come? What will the future bring for us? Like I said, the surge probably won't be until maybe the end of May, another 4 or 5 weeks away until we see the downturn. As I talked about, I think we're going to see surgical mask as a standard EMS PPE item for the very long future to come. It may become a norm for all calls. It's what is our opportunity. As we know, this will come back to us in the fall with influenza and the traditional flu activities, and we will be compounded with COVID and the flu. So thank you all for what you're doing. Thank you all for taking care of each other. We've had a few folks within the organization, career and volunteer, that have tested positive. A lot have tested negative for the virus. Most of those that have tested positive are already back to work, already back to their standby. And that's a testament to their dedication, the work of the folks at FROMS, and their private healthcare folks to make sure they're healthy and able to get back to work and standby. We as a group will get through the pandemic. Things are changing. Thank you for being flexible with us. And again, the one thing I want to sit on every session we talk about, take care of yourself, take care of your family at home. Your family is the one who helps you come to work, helps you come to your standby, and always thank them for their opportunity and their love and support so that you can come to help the residents of Montgomery County. Take care, everybody. Thank you much.